The short answer is no, that hormonal contraception does not always manage the pain that is caused by endometriosis. In fact, it's very important to speak with the patients when prescribing hormonal contraception that this is something that is a palliative treatment. It is meant to manage symptoms only. There's no guarantee that it's going to do anything to the endometriosis itself. One of the biggest risks that comes along with using hormonal contraception is that if there is an improvement in pain, it could potentially lull the medical professional who's prescribing the medication into a false sense of security or a false sense of reassurance, as well as the patient. Time and again, we have seen that endometriosis may continue to progress despite somebody taking hormonal contraception, which could lead to worsening disease, organ damage, and a more challenging surgery later on. So I definitely see a lot of patients who have a diagnosis of endometriosis suffer from gastrointestinal symptoms. And I think that that's for a few reasons. We know endometriosis is an inflammatory condition, and that inflammation likely spills over into the organs that geographically within the body sit very close to the pelvic organs. Take, for example, the bowel, which sits right behind the uterus, and the bladder, which sits right in front of the uterus. Additionally, there can be deep infiltrating endometriosis in areas quite close to the bowel, in particular the rectum and the sigmoid colon, that can physically touch those organs, and when they create an inflammatory environment around them, that can by proximity cause irritation and inflammation of the gastrointestinal organs, which can lead to issues with bowel movements, which can lead to irritation to the pelvic floor. This is a great question. So absolutely, I have absolutely seen patients with stage 1 and stage 2 disease, which is technically classified as minimal and mild disease, be absolutely debilitated and have very severe symptoms. On the flip side, I've also seen patients who have moderate and severe disease, which is typically stage 3 and stage 4, be walking around and be relatively okay, especially considering the amount and severity of disease that they have on the inside. So absolutely, we may not see this show up on MRI. So in order to answer this question, it's important to understand some background information. So endometriosis has been shown to continue to be active even after menopause, which is naturally when the ovaries stop working. And it has also been shown to be active even after the ovaries are removed. So this person's question about whether or not endometriosis can still progress after a full hysterectomy, and I'm going to assume full hysterectomy means removal of the ovaries as well. And is that because it wasn't removed at the time of surgery? I'm going to respond and say that that's probably a part of it, because if we don't remove the lesions, then they can still continue to be active and progress and grow. But there's also this kind of question mark as well, because we don't know exactly what causes endometriosis to form or what causes new lesions to form. So that's a big unanswered question. So during the series, I did get quite a few questions regarding MRI imaging and endometriosis. MRI can be very excellent at picking up deeply infiltrating endometriosis. When I use that term, I'm talking about endometriosis that is infiltrating into surrounding organs, for example, into the bowel, into the bladder. It can also be a form of endometriosis that's found on the ovary called an endometrioma. And MRI is quite good at detecting those. Where MRI might struggle a little bit would be detecting more superficial lesions. Some of the things that we can do in order to improve our diagnostic accuracy of MRI would be actually administering a contrast gel into the vagina or into the rectum or both. This helps to highlight the borders of these organs, and it can also be helpful to have a radiologist that has a specific interest in reviewing these scans that contain endometriosis. As a general rule, any imaging or study that I order, I'm reviewing the images myself because this helps with preoperative planning and for what we might expect at the time of surgery.